Hello, I'm back. Okay, I left off in my story with me visiting the thyroid surgeon, and I went ahead and had a successful thyroidectomy. They removed my thyroid successfully. However, after my thyroid surgery, I was in recovery and ended up having to be admitted because it took me 9 hours to wake up from surgery. Um, it's a mystery. I'd had several surgeries before this one, but this was the first time that they had trouble waking me up. It was really scary for my husband who was waiting, thinking that this would be a procedure where, I go home the same day. He's watching as everybody else is leaving with the person they came with, and he's just sitting there. He got a call from the nurse at one point, and was pretty much like, she's okay. So he knew I was alive, but he wasn't understanding why so much time was passing. And even the department where he was waiting, the waiting room closed. What I remember of the experience is there was a nurse, and she sat next to my bed, and she continued to tell me to breathe. Breathe, please breathe. Come on, you can do it. Breathe, take a deep breath. You're not breathing. You're not breathing. It was almost like my body was having trouble coming back. So this nurse was so dedicated that she didn't go to her lunch, y'all. Another nurse offered to watch me while she went to lunch, and she was like, no, I could hear this going on, but I couldn't respond. So eventually, now I had just had thyroid surgery, right? But because I wasn't waking up, they wasn't giving me pain medication. They were like, we can't give her pain medication. She's not even waking up from the surgery. And when I tell y'all, it was starting to wear off, the anesthesia, the whatever they give you, the local anesthetics, they were wearing off, and I was feeling it. I was like, you know, but it wasn't enough for me to completely wake up. So eventually I was mostly awake, and that was 9 hours in recovery. So they admitted me to the hospital. Once I woke up, the surgeon cleared me to go home. I went home and had an appointment to see my primary care doctor. Now, my primary care doctor had been changed. The primary care doctor that I had for 4 years prior was gone. She wasn't at the facility anymore. So they had let me know that I had a new primary care doctor, and that I should see that, new primary care doctor. And I had an appointment already set up. So when I went to see the primary care doctor, I expected, the normal, you're overweight. Do you have diabetes? No. Do you have high blood pressure? No. I do have Crohn's disease, and I have this thing going on with my neck that no one can give me an answer for. And I just found out that I have something called a superior vena cava occlusion. Do you know anything about that? So this primary care doctor that I had is this young gentleman. He was like, "Oh no, this is not okay. Wait a minute. You have what?" He's like, "I need to get you over to the interventional radiologist. Those are the vein specialists, artery specialists, and they need to see you because this is something that isn't normal." I'm like, okay. So he said, I'm going to put the referral in for them to see you, and we're going to have a follow-up appointment in 3 months. And I'm like, okay. Now, what I'm not telling about this story, which is the third road of it, is that over the course of me having these symptoms and them escalating, I visited the ER at least 10 times. And why did I visit the ER at least 10 times? Because I was suffering. I was afraid. My husband was afraid. Things were happening in my body that I couldn't explain. And every time I called ahead and said, this is what's happening, they said, you need to get here. When I went to the ER, most of the time, I was treated as if I was out of my mind. They would say things to me like, well, I know you're saying that this is happening, but we don't see any evidence of it. They, at one point, drug tested me. They drug tested me, y'all. There was no reason to do it. I have told them I ain't never used drugs. And the doctor said to me, whenever we have someone come in with these symptoms, we drug test them. I knew that wasn't true because I had been in there with those same symptoms I don't know how many times, and I was never drug tested. I had one doctor come in the room and leave and say she had an emergency that she had to go to and that she would be right back. I sat and waited for 3 hours. She never returned. I was having experiences in the ER to the point that I didn't want to go. I didn't trust anymore. And this wasn't the first time that I had an experience like this because it took them 8 years to diagnose me with Crohn's disease because they just simply didn't check for it. Yeah, even with colonoscopies, they just didn't check for it, although I had it. And so my faith in the medical and healthcare system was a little tainted. So even though I was seeing this new primary care doctor, I didn't really trust that he was going to be able to help me. But I went and I spoke up and advocated for myself and said, I am tired. I explained to him, it takes me a very long time to walk to my bathroom from my living room because almost every 5-10 steps I take, I'm out of breath. The thing is happening in my neck. It's bad. When I go to do my prayers and meditations in the morning, as soon as I go to stand up, I feel like I'm going to pass out. It's happening every day. So he's assuring me, these guys are going to have the answers for you. I'm going to send you to them. And I'm like, okay. Well, never heard from him. Never heard from the interventional radiologist. So I figured, guess they're not going to see me. So I follow up with my primary care doctor. First thing my primary care doctor says is, okay, let's, talk about your weight. And I said, how about we talk about the fact that those people never called me and I'm getting worse. So he was really good, y'all. He took all that attitude I gave him and he was pretty much like, they never called you? I said, no. He said, let me find out what's going on because I thought they saw you. And I said, no, they didn't. So he promised me he would call me back in 15 minutes. And he did. He followed through. He called me back. He said, we put the referral in. They rejected it and sent it back. And he said, but I put it in again. And this time I'm marking it urgent. I need them to see you for this. And I'm like, okay. I was happy that I was finally going to see somebody and they were going to give me answers as to what was going on. I now knew that I had something called SVC syndrome, superior vena cava syndrome, is what he told me I had. And it's something that, I looked up on the internet and I was like, oh my God, this sounds exactly like what's been happening with me for the last 2 years. So I was like, okay, I guess, these are the people that are going to fix it. They know what to do. I'm glad that this sounds way more like what I have than POTS. So I get myself prepared to go see the interventional radiologist. I go to that appointment. The interventional radiologist walks in with 3 other people. The interventional radiologist sits down and introduces himself to me and he asked me, was I by myself today? Now, all my internal alarms are like, what? It sounded like he was about to tell me something that I may not have wanted to hear. But I was like, no, I'm by myself. And he said, was there anyone that I wanted to call so that they could be with me while he speaks with me? And I was like, yeah, my husband. So I called my husband. I knew my husband was working that morning and having meetings and everything. But he answered his phone anyway, and I'm like, babe, can you like be on the phone while this doctor talks to me? He's like, I'm in a meeting, have to pay attention. I'm like, okay. He's like, can you record it? And I asked the doctor, can I record this? And he's like, yes. So I do. The doctor, the interventional radiologist, explained to me what an occluded superior vena cava was. But that wasn't the thing. The thing was, he said, I have all of your scans since you've been our patient. I looked at every CT scan that you've had of your neck and your chest. He began to go through them with me, showing me what he was looking at. He says, the first scans, look, your patent, you see this? This is your superior vena cava. It's open, blood's flowing through. And then, he says, over time, we're watching. I saw it's slowly narrowing. It's on your CT scan reports. It narrowed, and it narrowed some more, and it narrowed some more, and now it's closed. It's been closed for a while now. He said, I'm going to be honest with you, Miss Loper. You can't live without your superior vena cava. We have to fix this. Okay? He said, the place where your superior vena cava is occluded is very close to your heart. So what I can do is go speak to my colleagues and see if we want to take the risk of stenting your superior vena cava to open it up so the blood can flow to your heart in the way it's supposed to. He said, think of your superior vena cava like a highway, like a 6-lane highway that has constant traffic. That's what it is for your body. Now imagine all of that traffic having to be rerouted on dirt roads. That's what your body is currently doing and has been doing for a while now. All those little tiny veins, the zygos system, are the dirt roads that are carrying all the blood flow from your brain, your upper body, down to your heart. They've rerouted, but they're dirt roads. They can't handle the traffic. So, he said, I'm going to speak to my colleagues, and I want you to go home and speak with your family, because this will be a very, very risky procedure because of where I have to place the stent. And I said, okay. But as I walked out of his office to my car, I fell apart, y'all. I was like, what? That's what was happening? I cried. I called my daughters. And I cried. On the way home, my oldest daughter, she talked to me. She was like, Mom, you're strong. You're going to be okay. It's all right to fall apart. This is some pretty heavy stuff. But we're going to do surgery. Everything's going to be good. Right? So I did. I spoke to all the people who I needed to speak with, which was my family, my children, my husband, my mother, my godfather, my Oluo, my godfather. Spoke to everyone and did my spiritual work. Yeah. And went and called to schedule this procedure. Well, the doctor was away on vacation, but they said, okay, we'll get you in December, when he gets back. And so that was December of 2023. And I was ready to go, y'all. finally, I'm getting fixed. I was a little bit scared. I had to get all these testings done before they would even allow me to go into the ER. They wanted to, the OR. They wanted to make sure there was blood on standby, because what I was understanding from what he was telling me, one slip up, one mistake, I could bleed out in seconds because of what they were doing. Well, I was in that surgery. I woke up and I said, "You didn't fix me. You didn't fix me." I could tell it was there. It was still there. I was lying on my back. I felt the strangling pressure, and I was like, what happened? So the intervention radiologist, he said, "Listen, I tried to get to your superior vena cava to stent it 3 different ways. And he said, it just is collapsed. There is no getting to it with a stent. I've already called to have you see the cardiothoracic surgeon." I was like, okay. So it was Christmas the following week. I think it was on a Monday or something. But I got a call from the cardiothoracic surgeon the day after Christmas. And they were like, "We want you to come in on the 29th. I think it was the 28th or the 29th. And I was like, okay. So I'm on Google, cardiothoracic surgeons. What do they do? What are they going to tell me? Can they do some laparoscopic trick? I'm like, listen, because cardiothoracic surgeon now, I used to watch Grey's Anatomy. They was the ones cutting people open and stuff. I don't know about that. So I see the cardiothoracic surgeon, my husband and I. This time he comes with me, he takes off work, he goes with me. And cardiothoracic surgeon, just as the interventional radiologist did, pulls up all the scans, pulls them up, shows them to me. And he's like, "I don't know how you're sitting here, but your superior vena cava is completely occluded. It's closed. And it's been closed for a while. And we can't have that." He explained to me that the only way that they could guarantee to fix this was to give me an open heart surgery to open up my chest and to reconstruct my superior vena cava. Yeah. And so he was like, "I do surgeries on Mondays. Next Monday is New Year's. The following Monday is the 8th of January. And I'm going to have to do your surgery then. I would like to." I agreed. And so, January 8th, 2024, he reconstructed my superior vena cava. And that was just the beginning of the journey of 2024, which brought about more health challenges related to me having an occlusion for such a long time. Now I've told my story of the occlusion and the medical part. But the night before I had my surgery, I was very angry. And I was very angry because I did my part. When something didn't feel right in my body, I went to my trusted healthcare professionals and I told them what was going on. And I can't tell you how many times I was dismissed. I can't tell you how many condescending remarks were made. I can't tell you how many times the whispers and the looking at me like, we don't know what you're talking about. What makes it even worse is that the evidence was there the whole time. It was there, y'all. They were giving me CT scans of my neck and my chest again and again and again. And my CT scan results were showing that my superior vena cava was narrowing, and it also showed that it was closed. It was occluded. No one told me this, did anything about it, thought it was even an issue. My primary care doctor had those results in her hand, and she told me I had POTS. Although, even if you go to Google, almost every symptom of a superior vena cava obstruction, occlusion, I showed almost every symptom. I had swollen face. I had the bulge in my neck. From what I understand from the cardiothoracic surgeon, it was pressure. So he said every time I was moving, it was like having a stress test. He said that the reason why when I would bend up and stand up as the blood was trying to drain from the upper part of my body, it was almost like it had nowhere to go. I was in trouble. And I lived like that for almost 2 years. It started in 2021, the symptoms. But I'm here. I'm alive to tell this story. I don't know if there's other people who have a similar story about something like this happening who are alive to tell it. But I am. And I tell it because I urge the healthcare professionals to listen to your patients. Listen to them. When they're telling you that something's going on in their body, something isn't right, something just feels off, whatever, listen to them. I urge the healthcare community to stop dismissing Black women, Black people. Yes, I'm going to go there because that was a big component. I remember one time walking out of my primary care doctor's office and I was so out of breath, I was kind of leaning on the wall and I overheard the nurse suck her teeth and it's not that serious. It's not that serious. Yeah. So I've shared my story about the occlusion and why today's an important day for me. And I pray that this reaches who it needs to reach. I hope it helps somebody. After my surgery, many people advised me to sue the healthcare facility. I never went outside of their system. Every specialist I saw was there, and they were like, you need to sue them. Truth be told, I told my husband, if I die when I have this surgery, I need you to own a part of that hospital. But I don't want to do that, y'all. What I want to do is bring awareness to it. I want to bring awareness to it. I want to be free to speak of it. I don't want to take hush money. I want things to change. And so I'm trying to do my part to help in that change. So all of that being said, thank you for listening to my really long story about my superior vena cava occlusion. And it's something I'm going to be writing about. So there'll be more coming from me about the journey, the healing journey, the spiritual journey, that part of it, and also my ideas about where we can go from here to make healthcare better in our country for our people. So, thank you for listening.